Welcome to the April edition of Trainer Topics. As you know, there are many measurements used in the fitness industry that are also widely used in the medical field as well. A lot of terms that get thrown around that you may not know what they are. Today we're going to talk about the difference between BMI and waist to hip ratio, and why BMI may not be the most effective tool to really gauge where you are on your fitness journey. This month we've got our April 2022 Trainer of the Month, Program Manager Shawn Stanley with us, and of course Health Fitness Professional Adam Grosskreutz. Welcome, guys.
Thank you.
All right, so Adam, I'm going to kick it over to you first. Why don't you just give us a little bit of an idea of what BMI is?
So BMI stands for Body Mass Index. Your body mass index is your weight in kilograms, and we divide that by the square of your height in meters. So we're taking that weight and we're incorporating our height. What this does is it screens for our risk to any health complications, but it does not diagnose any kind of health complications or body fatness. It is just more of a general marker of risk.
Now, Shawn, obviously we hear BMI talked about a lot, but not so much waist to hip ratio. So just let us know a little bit about what that means.
Yeah. Waist to hip ratio is calculated by dividing your waist measurement to your hip measurement at its widest part. And it's also a simple but useful measure of fat distribution, especially when we talk about proportion of the waist to the hip. And in my opinion, the use of waist to hip ratio is more accurate in painting a picture of your client's health as well as their risk than BMI.
Now, Adam, as we know, BMI obviously can be a useful tool, but there are some things to think about when it comes to BMI.
Yeah, so BMI is a great tool for general population, but for our population that is in the fitness center, they're weightlifting, they have a higher prevalence of muscle mass, it's going to be a little bit more inaccurate. For example, myself, if I'm lifting several times a week, when I do my BMI, it actually places me in the overweight category. I'm not what I would consider overweight, but for a lot of folks that are checking and going through the calculations and they're like, how come I'm overweight? I work out 5-6 days a week. That's not going to be as useful as for our general population that is not engaging in resistance training.
Now, Shawn, you did say, in your opinion, that waist to hip ratio is the better tool to use. Why do you feel that way?
Well, the reason why I feel that way with the waist to hip ratio, probably the main measurement is the waist measurement. And that measurement is going to estimate or give you an estimation of the visceral fat, which is the dangerous fat that coats the internal organs. And with waist to hip ratio, you have two different body shapes. You have what we call an apple shape, where your waist is wider than your hips, and then we have what we refer to as pear shaped, where your hips are wider than your waist. If you are apple shaped, which is an indication of that waist circumference, that's where you are at higher risk of things such as cardiovascular disease, cancer, type 2 diabetes, metabolic syndrome, and premature death.
Okay. Now, obviously with any measurement that we do, there are some considerations to take into account with the waist to hip ratio.
Yeah, some of the things to take in consideration with the waist to hip ratio, obviously that measurement's not foolproof. Depending on the person that's doing the measurements, the measurement could be inaccurate, could not be measured right, so obviously that would skew the numbers. It's also important to note that waist to hip ratio should not be an indicator for children. We certainly don't want to perform that particular assessment on smaller children. And then also, waist to hip ratio should not be relied on as the sole measure of obesity or health risk. And if you feel like that you're at risk, or you feel like that you do have that apple shape, I would certainly consult with a physician.
All right, so as we tell you guys each month, there are many sides to the fitness industry, and a lot of questions pop up. You know, Shawn's waist to hip ratio, Adam's BMI talk raises a lot of questions. We invite you to come on out, talk to Shawn, talk to Adam, talk to any of our staff here, and ask those questions. That's what we're here for. So anyway, thank you guys for being here, and we'll see you all next month.